Hey everybody, welcome back. Bob Finelli here, physiologist, kinesiologist, and today on Going Deeper, we're going to talk about the abdominals in the core, a really fun, awesome part of the body that everybody's super interested in. So what we're going to look at today as we go deeper is, are we actually training our abdominals and core maybe the best way that we could to give us the highest level of function? So to do that, if I'm a muscle or a group of muscles, there are 4 questions that I will ask you that I want you to be able to answer so that I know that you know what I do. Number 1 is, where do I live? Like, what are my attachment points? Because where I attach on bones is clinically significant. Number 2 is, who are my friends? Because as a muscle group, which is what the abdominals are, I don't work alone. Number 3 is, what do I actually do for you? Because I have a role. And number 4, maybe most importantly, what turns me on? Because as the abdominals, I don't have my own brain. So let's dive into it. So hi, I'm your abdominals. Thanks for coming to work with me. What I'd like to do today is tell you a little bit about myself. First of all, where do I live? Well, it might be interesting for you to know that I attach from ribs 4 through 12. I'm not up at 1, I'm not down at 7, 4 through 12. I then come down and I attach here to your pubic symphysis. I also attach to your pelvic crest, which is very interesting, and I wrap around and attach to the spinous and transverse process of your lumbar spine. That's why I can help out your low back. So that's a pretty big neighborhood. You might want to know that some of me actually mostly run straight up and down like the rectus abdominis. Some of me go diagonal like the obliques, and some of me, and here's a clue, called the transverse abdominis, actually wraps all the way around in the transverse plane. So abdominals, tell me more, this is intriguing. Like, who are your friends? Well, the abdominals would say, see, the hand, when you move it, it drives my rib cage, okay? And so because I attach to the rib cage, if any of your shoulder muscles are tight, that could affect me. Oh, and by the way, there are 17 muscles that attach to the scapula. Hey, wait a minute, abdominals, are you telling me if I have a tight shoulder or upper back that could shut you down? Yes. Okay, abdominals, tell me more. Well, number 2 is, I told you I attach to the pelvis, and your femur can drive your pelvis. And there are 22 muscles that attach to that femur. Some of them, like your hamstring, actually go down and attach to your tibia. Wait a minute, abdominals. Are you telling me that, for example, if my hip flexor, if my hamstrings, if my quadriceps, if any of those muscles are tight, that could affect you? Yeah. Wow, abdominals, that's a pretty big neighborhood. Exactly. So tell me, abdominals, what do you actually do for me? Well, it's kind of exciting. What I actually do based on where I attach is I control motion between your pelvis and your rib cage. When your pelvis is moving one way and your rib cage is moving another, that's me. And in fact, you use me all the time. If you want to throw a ball, you go backwards first. You know why you do that? Me. When you kick a ball, you go back here. You know why you do that? Me. When you hit a ball, you know why you do that? Me. In fact, try and throw a ball, but don't twist. It's not going to go as far, is it? And in fact, your elbow and your shoulder might actually start to complain. You know why? You didn't use me. Wow. Abdominals, that's amazing. So tell me, what turns you on, abdominals? What gets you excited? Well, I'm just like all other muscles, in that motion is what gets me excited. In fact, motion turns on proprioceptors, proprioceptors turn on muscles, and I get my power from lengthening, not shortening. Example, if you drive your hand back over your head like you want to hit that tennis ball, guess what? I do that for you. If you want to cut laterally and rotate or swing, I do that for you. I decelerate motion laterally, I decelerate motion over your head, and I decelerate motion when you rotate behind you. All of those things are what I do and what turn me on. In fact, you know what's really kind of confusing to me? Why sometimes you tell me to hold still. In fact, motion turns off proprioceptors, which turns off muscles, and then you kind of have to consciously with your brain tell me what to do. I don't really respond to that. In fact, that kind of confuses me. So what you really want to do is think about all of these things that I shared with you, because you know what I can do for you? I can protect you from that ACL tear. I can protect you from tearing out your rotator cuff. I can protect you from blowing out your low back. I can help you create the arch to your foot, believe it or not. All of these things are things that I can do, but You have to know who I am, where I live, who my friends are, and what I do. Treat me authentically, and I'll do the best that I can for you. And in part 2 of Going Deeper, we'll talk about how do you actually train the abdominals authentically.